Medical news from MedRxiv. Recovery trends show greater quadriceps weakness after patellar tendon versus hamstring autografts in ACL reconstruction. Knee extensor strength remains markedly lower after anterior cruciate ligament reconstruction, ACLR, when a patellar tendon autograft is used, and this deficit persists throughout the first postoperative year, potentially delaying safe return to sport. In a large series of young athletes, those who received hamstring tendon grafts recovered quadriceps strength more rapidly and achieved better symmetry between the operated and uninvolved legs than their counterparts with patellar tendon grafts, highlighting the need to tailor rehabilitation protocols to graft type. ACL injuries affect millions of active individuals each year, with the majority undergoing surgical reconstruction to restore joint stability and enable a return to high-level activities. Although it is well established that both knee extensors, quadriceps, and flexors, hamstrings, suffer strength losses after ACLR, most prior work has reported only static snapshots of recovery, typically at a single time point such as 6 months. Consequently, clinicians have lacked a clear picture of how strength evolves over the critical first year and whether the choice of autograft influences that trajectory. This knowledge gap is especially relevant because contemporary return-to-sport criteria increasingly emphasize limb symmetry indices for both extension and flexion strength, yet the impact of graft selection on achieving those benchmarks remains uncertain. The investigators conducted a retrospective case series across multiple sports medicine clinics within a large health system, enrolling 503 patients, mean age 17.8 plus or minus 3.0 years, who underwent primary ACLR with either a bone patellar tendon bone, BPTB, autograft or a hamstring tendon autograft. All participants completed a standardized battery of isokinetic strength assessments at several intervals up to 12 months post-surgery, yielding a total of 730 combined return-to-sport test sessions. Peak concentric torque for knee extension and flexion was measured on both the involved and uninvolved limbs using a calibrated dynamometer, and values were normalized to body weight. Symmetry indices were calculated as the ratio of involved leg to uninvolved leg torque, expressed as a percentage. The study design allowed for longitudinal tracking of each patient's strength profile while also comparing the two graft cohorts. Across the entire cohort, quadriceps torque on both legs increased steadily over time, and the symmetry index for extension improved from an average of roughly 80% at the first postoperative assessment to near parity, almost equals 95%, by the 12-month mark. However, when graft types were compared, the hamstring group consistently outperformed the patellar tendon group in involved leg extension strength. At the 6-month checkpoint, the hamstring cohort exhibited a mean extension torque that was approximately 8% higher than that of the patellar tendon cohort, p less than 0.01, and the corresponding symmetry index was 5% greater, p less than 0. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.